Welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price, and I'm going to go over a routine to help reduce low back pain or mid back pain that is related to overcontracted extensor muscles in the back. Before I begin, I'm going to speak a word of life from 2 Corinthians 12:9. My grace is sufficient for you, for my power is made perfect in weakness. Okay. So if you've got low back pain or mid back pain and you have been doing heavy lifting, so if you've been deadlifting and you have arched your back or you have a sway back and you tend to use your back muscles to lift rather than using your glutes, you may have overcontracted your back muscles, and that can be painful if there's trigger points all throughout the back and they stay in a very tense state. So it's like taking a tennis ball and squeezing it for 10 minutes. After 10 minutes, your hand is going to hurt. So if you are doing that to the back muscles, then the back can hurt. So please consult your physical therapist or medical doctor for the appropriateness of exercises for you before you begin an exercise routine. So what I'm going to do is go through a series of releases and stretches and then strengthening in order to restore the muscle tendon relationship and to mitigate that sway arch back. So I'm going to start with my latissimus muscle. I'm going to use various tools. I'll use a double lacrosse ball. I'm going to use a weight for strengthening, and then I'm going to use a foam roller. So the whole goal is to get out of that sway back, so that arched back. We want to reduce that, and so we want to strengthen the core muscles in the abdominal front region, and then we want to open up the back and reduce these contraction of the extensor muscles. So I'm going to start with a latissimus roll, and that is going to go from the crest of the hip, so the iliac crest, so that's the top of the hip bone. That muscle is going to have a fascial connection to the top of the hip up into the shoulder, and it connects from the thoracic spine, so the mid back down into the low back. And it will extend the back, so if it is contracted, it can cause the back to arch. So we're going to release there to start with. And to check to see if you have an imbalance from side to side, you can stand and rotate one side and rotate the opposite. If you feel a difference in the rotation, then you want to address the latissimus muscle. I'm going to use a foam roller. I'm going to go onto my side, and I just want to go along the outside of the rib cage. So from that top of the hip bone along the outside of the rib cage. I'll support my head and neck with my hand, and then I'm just going to apply pressure to that area, and I'm going to go all the way up into the armpit and then mobilize and move all the way down to the bottom of the rib cage, but I'm not going to go into the low back, so I'm going to stay on the rib cage so that I am not compressing any areas in the low back. Now, when you feel like you're going slow, you want to go slower. And I want to spend about 2 minutes on each side so that I balance those muscles. So after I have released the latissimus on one side, switch to the opposite side and do the same thing. You're going to support your head and neck with your hands, and then just slowly go along the rib cage, the side of the shoulder blade up into your armpit. And if you find an area that is tender or feels tense, you can hang right out on that area till it reduces in tenderness or you feel the tension reduce. You can even gently rock back and then forward so that you're going perpendicular along that muscle and allowing the muscle belly to release. So start with the latissimus muscle. Then I'm going to balance the hips by going into a stretch where I bring one leg forward and one leg back. My hand of the leg forward is going to go on the inside, and I'm going to bring my other hand next, and I'm going to just stay in this position, resting the back leg. I'm going to hold this for 30 seconds, alternate back and forth, do 3 of those to start with. This is going to help to decompress the back so that we can open up the back with more ease. So switching, The front leg, you want the ankle to be in line with the knee. The hand is going to go on the inside of the ankle, resting the back leg, and just allowing yourself to stretch. You should feel a strong stretch on the inner part of the thigh with the leg forward, and you may feel a mild stretch on the front of the leg that is back. There should be no back pain in this position. And if there is, then you want to stop and discontinue. Something else needs to be addressed before doing this. All right, after I have done the latissimus release and then began with this stretch, then I want to go into releasing the erector spinae. The erector spinae extend all the way from the base of the skull down into the pelvic region here. So I want to go through and release all of those muscles, but I don't want to go over the back because I don't want to compress the back, and I'm not going to go over the neck. So I'm going to stay between my shoulder blade. I'll take double across balls, and I'm going to start between the shoulder blades up high, and then I'll show you, we'll get down and release the sacrospinalis down low, and there's going to be between these two bones on the back side. Those are your PSIS. You're going to place the lacrosse ball just inside there, and we'll release the muscles there. So I'm going to start. Lacrosse ball is going to be between my shoulder blade. I'm going to lie onto my back, and then I'm going to lift my bottom and mobilize the lacrosse ball down between the shoulder blades, and I can continue on the thoracic spine, but not if I have low back pain. So if you put pressure here and you have low back pain, then you want to stop. The discomfort should be right where the pressure is with the lacrosse balls. After I have released the erector spinae between the shoulder blades, and depending on how tight it is, you can spend up to 5 and 10 minutes in that region. Then I want to go on my sacrospinalis, and that's going to be on the lower part of your low back, but you're not going to be on your low back. You're going to be on the sacrum, which is that triangular bone at the bottom of the spine. I'll take the lacrosse balls, place them right between those two bones, and then I'm going to go a half an inch up and a half an inch down. And I'm just going to spend 2 minutes here to release the tension there. So I'm releasing the erector spinae, the muscles between the shoulder blade, and the sacrospinalis, which are the erector spinae that extend down into the sacrum, releasing those muscles. Then I'm going to go into a moving sacrospinalis stretch, which is when I'll get onto all fours. I'm going to round out my back, and then I'm going to push through the heel of my hands and bring my buttocks down to my heel, and then move back and forth for a minute. So I'm stretching. I should feel a stretch in the back as I do that, and just continuing to do that back and forth. Do this stretch for a minute, then going back into the latissimus release. I'm going to go back to release the latissimus muscle, spend about 2 minutes there again. So I want to go ahead and release the tension on the latissimus, and then I'm going to stretch my lats, and I'm going to do that in a forward folded position. So each side spending 2 minutes again to release the latissimus muscle, and then going into a lat stretch. I'm going to forward fold, and then I'm going to walk my hands over to one side, and you're going to feel the stretch through the side, and hold that for 1 minute, walking the hands to the other side, and holding that for 1 minute. So that is going to stretch my latissimus dorsi after I have released that. So we've stretched now the erector spinae, the latissimus muscles. Now we want to strengthen our core from the front, but we want to do this without engaging our back muscles. Sometimes that can be a little difficult. So what I want to do is I'm going to do an active release or an active stretch, taking my legs, bringing them up towards the ceiling, and then I'm going to bring my feet down to the floor. Now I want to engage my abdominals, and I want to open up the spine. So I'm going to bring my arms overhead, and then I'm going to touch my feet down towards the floor, bringing them back up and using my abdominals to bring the feet to the floor. and then coming back up. And I want to do 2 sets of 25, so I'm going to do 50 of these. And this should feel good to your back. So there should be no pain. You should maybe have a stretch on the back when you bring your feet down, but you should not have pain. It should feel like a stretch. If it is painful, then you're not ready for this exercise yet. After I do that, I'm going to use my abdominals by coming from the top up. So I'll bring my legs, bring them up, take a weight, and I'm just going to lift up towards my feet and come right back down. So I shouldn't have any contraction going in my low back. All the contractions should be coming from the abdominals. So here I'm going to use my abdominal muscles, and I will do 2 sets of 25 of these exercises. Next, I'm going to use an abdominal wheel. And what I want to do is make sure that I'm focused on my abdominals for this exercise. So what I'll do is I want to bring my navel into my spine, rounding my back, and then lowering my body, but not allowing the back to arch. So I want to make sure that I'm keeping my core contracted. And as I come back, I'm going to pull with my abdominals so that I'm getting more of a rounding in the back. So I'm going to lower myself down. If the back arches, then you want to stop. Push down through the wheel and engage the abdominals, rounding out, bringing the navel to your spine as you come up. And 2 sets of 25 here to activate the abdominal muscles. In this one, if you're having any low back pain, you want to stop doing this one. If you do it correctly, it can really help to engage the abdominals and get the back to shut down. The last abdominal exercise that I'm going to do are going to be crunches with the therapy ball. And the reason I use the therapy ball is it'll allow me to round my back. So as I walk my legs out, I'm going to be able to have the softness of my back sinking into the ball and allow me to go from a neutral position to a flex position, and that's going to keep the back from firing. So I will do 50 crunches. You can even come back. As long as you are keeping the back in a neutral position and you're not getting the arch or feeling the muscles working on the back side. So you want to feel all the work coming from the abdominals and 50 crunches here. So that's a lot of abdominal work, and that's going to be great to shut down those back muscles that have been overcontracted and possibly strained from heavy lifting and using those back muscles. So that routine can help you begin to release the tension that is promoting that sway back, and it's going to help strengthen the abdominals to get you out of that sway back position. After I do the crunches on the ball, the last exercise that I will do is going to be similar to the first stretch with the leg back. So we're going to get a hip flexor stretch, but this time I'm going to try to bring my elbows down to the floor. And I'm going to do the same thing I did earlier. I'm going to do 3 sets of 30-second hold each direction. So alternating, opposite leg, resting the back leg. The knee is going to be in line with the ankle, and I'm going to work my elbow down to the floor. You can use blocks if you cannot get down, but you're just going to try to lower a little bit more until you're able to rest your elbows onto the floor. There should be no back pain here, and this is going to help to decompress the back and get you out of that sway back position. So that is the completion of an exercise routine to help mitigate the sway back and to work on turning on the abdominal muscles and off those back muscles that are overcontracted and most likely contributing to the back pain. I hope this is of help.